Hello and welcome to Nourishing Diversity, Perspectives on Black, Indigenous, and Hispanic Community Food Initiatives. I am Nourishing Jones and I'll be guiding us through today's session. Just a few housekeeping items. For your awareness, this session is being recorded. For your future reference, all recordings will be available after the event. Closed captioning and language interpretation is available. And finally, questions and answers will be at the end of this session. So please enter all of your questions in the CVent event page in the chat for this particular session. Again, I am Nourishing Jones, a proud member of Share Our Strength. I am a program manager for the No Kid Hungry Florida campaign, and I'm glad to be guiding us through today's session. You won't be hearing from me much, but the experts on this amazing topic. Our first speaker is Shelly Fayant, Bitterroot Salish, resides on the Flathead Indian Reservation in Western Montana. She graduated from the University of Montana with a bachelor's in science in business administration. She served on the Confederated Salish Kootenai Tribal Council for 8 years. During her tenure, CSKT adopted a resolution addressing food insecurity, and as the chairwoman, she established a food sovereignty committee in 2020. She resumed her food sovereignty work, focusing on increasing access to locally grown healthy foods in Joko Valley, developing food-based programming like food cooking classes, community dinners, and with the Arley Community Development Corporation hosted a 1-acre garden for life. She serves on the Buffalo Nation's Food System Initiative Advisor Council based at Montana State University. Thank you for being here today, Shelly.
Thank you.
Absolutely. And I do have one question before you start your presentation. Could you share with us some of your personal motivations and the driving forces that fuel your passion for the work you do in this realm of food insecurity?
Sure. I'm passionate about my efforts towards food security in that my great-great-grandmother lived to be 112. My great-grandmother lived to be 82. My grandma 57 and my dad 50. So today's my birthday and I'm way past 50. So my family's life expectancy trend is on the upswing. And for all of you to know, Native Americans in Montana have an average life expectancy 20 years less than their non-Native neighbors. So much of this has to do with the food we eat, as well as other influences foreign to our people. So this has been my North Star.
Amazing. I'm sure just like me, everybody in the room is happy to hear what you have for us today. And so I'm going to kick it off to you.
Okay. Good afternoon, everyone. My Indian name is Eagle Woman. My English name is Shelly Fayant. I'm a Bitterroot Salish mother of 4 adult sons. I have 6 granddaughters, 1 grandson, and a great-granddaughter. And my mother lives down the road from me in the house that I grew up in, less than a quarter of a mile away. So we're very blessed to enjoy 5 generations in our family. My mom is of European descent. My dad was Bitterroot Salish. Our tribe is located in western Montana near the largest freshwater lake west of the Mississippi, that being Flathead Lake. I'm the food sovereignty chair of the Arley Community Development Corporation, or as I fondly refer to the nonprofit ACDC. Our traditional food system was interrupted in the era and resulting reservations. The Bitterroot Salish, Kalispet, and Kootenai tribes entered into the Hellgate Treaty of 1855, thanks to Governor Isaac Stevens and the U.S. government. We were forced to stop those life ways that involved following our foods. And you can go to the first slide. Our first food, the bitterroot, reappears in May every year. With climate change these past few years, it has varied anywhere from 2 to 6 weeks. Next comes the camas bulbs that we dig in June. Then all the berries all summer, followed by our hunting season. Traditionally, we enjoyed fish all the time, including ice fishing in the winter. Also, we traveled across the continental divide to hunt buffalo twice a year. That involved extreme physical activity, as did all of the harvesting and food preservation activities. Our diets also included a lot of greens that we foraged in various Aboriginal territories that we traveled to. When the fish would get low, we would move on to another area. These past 2 years, our streams have heated up due to climate change and fish kills have resulted. So to recap, in my native background, we're hunters, fishers, gatherers, no farming or gardening background. In fact, we kind of had a rough introduction to that lifestyle during the reservation era, in that government officials promised us rations in exchange for staying within the reservation boundaries. So there was no more buffalo hunting for several years. If the rations were distributed to the original peoples of the land, sometimes they were spoiled. Often the Indian agent kept them to himself and his family. These rations were things we were not familiar with: flour, lard, sugar, etc. Our people were creative, however, and survival foods like fry bread were discovered. Many of our health disparities, such as high incidence of diabetes, obesity, and cancers, are a direct result of these intentional government policies to kill the Indian and save the man. Farm implements were distributed as well. Some of our people did, in fact, become ranchers, raising cattle, my family included. Luckily, my family still practiced subsistence hunting and fishing. And during the Depression, our grandmothers planted gardens to feed their families as well. And one last bit of history to set the stage. When the boarding school era took my parents' generation away from their families at the tender preschool age and kept them for the school year, those individuals didn't have a chance to learn the food ways of our people. I've heard elders recount those days, and some said they would head to the mountains in the late summer to avoid having to go back. Sometimes they were sent to out-of-state boarding schools like Chemawa, Oregon, or Flanders, South Dakota, until age 18. And if they made it back alive, they definitely didn't learn their traditional food ways, such as hunting and fishing, which foods to gather when, and how to prepare. So I tell you this history to help you understand that Indigenous people have suffered food trauma. We see different food traumas today at the food pantry that Arlie CDC administers. The stigma, shame, and embarrassment at having to use the food pantry is real. We try to make the experience as welcoming and comfortable as possible in our community. Through No Kid Hungry, the Arlie CDC has looked at upstream solutions. Next slide. And I'm here today to tell you about our No Kid Hungry journey, some of our successes, and some of the obstacles we encountered along the way. Next slide. Our cooking classes were a big hit. My niece happens to be a professionally trained chef. At the time of our No Kid Hungry grant, she worked at a fine dining restaurant in Missoula, Montana, and I asked her if she would teach 3 cooking classes to community members. The menu had to be fairly easy, budget-friendly, and delicious. The first 3 classes focused on knife skills, and participants were gifted a chef knife after their classes were over. The youngest participant was Cameron, and you can see him here. He's age 6, and he came weekly with his aunt. His favorite part of it was plating, which makes sense because he's very artistic. Next slide. When the word got out in our community, I got a message from another Indigenous chef who works at another fine dining restaurant in Missoula. And this young man, who is both Salish and Blackfeet, approached me with a proposal for 5 cooking classes, including using buffalo, trout, wild rice, amaranth, and the 3 sisters, corn, beans, and squash. These classes were popular as well and drew a different crowd. Next slide. Addie's class was tasked with cooking a dinner for the community after the 3 classes. These dinners brought our community together to share a meal. We were able to gather, something our people are still a little anxious about since COVID. The pandemic really did a number on our people as far as food security. People finally realized how fragile our current food system is. When we ask people what the barriers are to cooking homemade meals, many say time and money. A lot of residents travel 30 miles one way to work, and many work 4 10-hour days, so time is of the essence. Some opted for fast food when it was the cheapest thing around, but today even that option is becoming more expensive. So budget-friendly, easy, delicious recipes were the answer. These Sunday classes were so popular that participants asked for another round of classes. The second session focused on butchering and preparing meat and fish. They filleted salmon, cut pork loin, and cut up whole chickens. Participants were incentivized with cutting boards to add to their kitchen arsenal. Next slide. Our last No Kid Hungry project was a community garden, which was actually a 14-week curriculum, learning the science of it all. We started with an acre of land next to our celebration grounds. The Confederated Salish and Kootenai tribes donated the use of this land along with 6 other plots across the Flathead Indian Reservation for this project, designed to take gardening to the next level and provide our people with organic, locally grown vegetables. Next slide. We blessed the site with sage and said prayers for a bountiful crop and community building project on Earth Day 2023. 3 generations of volunteers showed up to clean the site, and we filled a pickup truck with bags full of weeds and garbage. Next slide. And this is just a few more pictures documenting that day. We had a lot of kids participate that day. That was awesome. Because our Lee is mostly gravel as a result of glacial Lake Missoula, we had to bring in black dirt. Our tribal forestry program has a greenhouse, so we contracted with Salish Kootenai College's heavy equipment program to haul loads and loads of dirt for our garden. Then we purchased organic compost from a tribal member who makes it from local grass, leaves, wood chips, and fish. We have an excess of Mackinac in Flathead Lake, which are not native, so he is able to get fish guts and remains from our Native Fish Keepers Corporation to create a high nutrient compost. We also learned how to make our own compost from brown and green material. Next slide. No Kid Hungry funds allowed us to purchase a shed, so we're able to store our tools, wheelbarrows, all the things on site. Next slide. We also purchased wildlife fencing, as we have a lot of deer, bears, and other critters that would love to nosh on our produce. Our tribal lands department has a fencing crew, so they put up the fencing free of charge. Next slide. We mapped out 55 rows on our site. The idea was each person would plant and tend to a row. Well, 6 to 8 people attended the weekly classes, so we each ended up planting and tending to several rows. We planted some seeds and some starter plants from Salish Kootenai College Extension greenhouse. As you can tell, this project was a huge collaboration with several partners. Yet we still have work to do to involve more people next year. Next slide. We also built an irrigation system, which was a game changer. This summer, we had several 90 to 100 degree days, which is not normal for Western Montana. We're still watering. Our temperatures this week have ranged from 57 to 70 degrees with some frost the past 2 weeks. So we're real farmers, watching the weather on an hourly basis these last few days. If we think it will frost, we put our frost cloth over the tomatoes, peppers, and tomatillas, and the rest of our crops are pretty much winter crops like cabbage, beets, squash, etc. Next slide. As I mentioned previously, the Garden for Life included a 14-week curriculum covering everything from prepping the soil to cleaning up the garden and putting it to bed. Next year, we plan to indigenize the curriculum a bit and incorporate traditional ecological knowledge. Go ahead, next slide. And bugs. Personally, I saw ladybugs, worms, centipedes, earwigs, and praying mantises, which we've been seeing more and more of these last couple of years as a result of the changing climate. Praying mantis are not native to Montana. Next slide. We have shared our bounty with our families, friends, and neighbors, daycares, senior citizen centers, our food pantry clients, our Salish language immersion school, tribal health department sponsored a harvest fest, and we've just counting on this outreach to bring more families to the gardens next year. Next slide. I have to give a shout out to another partner, which is AARP, which provided picnic tables and benches to make the site more accessible and appealing to those ages 55 and older. And this Friday, a cross-country team from 200 miles away is going to have lunch at the site, specifically because one of their athletes has a severe wheat and gluten allergy, and they try to eat outside as much as possible. They heard of the garden through our social media presence and website, so I'm looking forward to that. Yay, social media. I never thought I would say that, ever. Next slide. We grew so many veggies. I can't even begin to tell you all the things that we grew. Next slide. And these are some of the pictures throughout the season. Next slide. So just a little updated figures as of October 9th. We did a tally and we have produced over 14,637 pounds of fresh produce. That's over 7 tons of food at a retail value of $55,449. So in summary, our culture is dynamic, ever changing, and gardeners we have become. We're trying to change the palates of our people to move away from sugar and carbs and incorporate more physical activity along with that. If we eat like our ancestors and return to the concepts of food is sacred and food is medicine, then we will return to the healthy people we once were. We had no diabetic hunters. We had no obese warriors. We have seen the most success with our children. They'll eat veggies straight out of the garden, not even washing the carrots. Some of the adults are really set in their ways and they don't want to try different veggies. Although when we taught the cooking classes, they were willing to try those with just maybe using a few herbs they hadn't used before. So in conclusion, our climate is changing, our culture is adapting, our ancestors were food secure and the foods they ate were good for the body, their heart health, blood, etc. Our efforts are based on the premise, a nation that cannot feed itself is not truly sovereign. Thank you for your presence today.
Thank you so much, Shelley. Food is sacred and food is medicine. And so thank you for that intentional setting, not just the work that's being done, but also the historical context behind it. So thank you so much, Shelley. We're going to move to our next expert, Deborah Moore, an experienced professional in community and economic development. She served 27 years in the state of Mississippi before transitioning to the nonprofit sector. Currently, she is an adjunct instructor in management for Delta State University and serves on the board of Delta Fresh Food Initiative. She is a former member of several nonprofit boards, including Mississippi Center for Nonprofits, Cleveland Youth Council, and Friends of the Environment. She holds a BBA and MBA degree from You guessed, Delta State University. A certification as an economic development finance professional from the National Development Council, and a PhD in human capital development from the University of Southern Mississippi. In her free time, she enjoys traveling, watching movies, reading, researching, and spending time with her family. Thank you for being here with us today, Deborah.
Thank you.
Absolutely. And I'm going to pose the same question to you. How did this work become one of passion for you, one that you have led your life's work in? I'm sure we're all ready to hear.
Right. So I was born and reared in the Mississippi Delta in Cleveland, Mississippi. And there's a history of poor health and poor nutrition in Mississippi. I'm 63 years old and I'm vested here. This is home. I'm not going anywhere. And the Delta is very rural, and access to fresh and healthy food is crucial to better health. In some areas, people are 15 to 20 miles from a grocery store. So I'm from a very large family of 14, and I've lost 5 brothers due to heart conditions, which related back to health and healthy eating. So I want to be able to be a voice and an agent for change as it relates to food insecurity. And that's what led me to my work with Delta Fresh Foods. So the Delta Fresh Foods Initiative, if you go to the next slide, was born in February 2010 in partnership with Why Hunger. And Why Hunger is a national nonprofit organization committed to building the food movement throughout the country and around the world. So in February 2010, about 130 local folks were convened at Delta State University in Cleveland, Mississippi, to share our vision for a healthy Mississippi Delta and to establish a common understanding of the challenges and opportunities facing Delta residents. And we also developed a community action plan to make our vision a reality. After convening at Delta State, we had our first executive director, Ms. Judy Blue, and Delta Fresh became incorporated and became a 501c3 in 2012. So over the next 11 years, we successfully implemented a variety of local food projects, and Delta Fresh grew and developed into a strong network of committed members who were working together to build supply and demand for fresh, locally grown food in the region by bringing together other national and local partners with a variety of resources, providing training and technical assistance for sustainable growers, consumers, and advocates, and engaging the next generation in building food systems. Next slide, please. So Delta Fresh is committed to building sustainable, equitable, community-driven food systems to strengthen the local food economy and promote healthy lifestyles in the Mississippi Delta. Next slide. What you see here are the 18 counties in Mississippi called the Delta. The Mississippi Delta is 200 miles long and about 70 miles wide at its widest point. The Mississippi Delta has a unique history of slavery. By the 18th century, settlers were importing enslaved Africans as a source of labor, and the Delta plantation system started in the 19th century when white farmers went there in search of fertile farmland, bringing with them slaves to do the backbreaking work of clearing the wild forest and subduing the Mississippi River with levees. The region's history has had debilitating legacies, including the sharecropping system, the Jim Crow laws, the concentration of wealth in the hands of a white population, political disenfranchisement of Blacks, and the nearly total social segregation of the races. This history still has an impact today, and there's a stigma that's attached to the land for African Americans. So although the Delta is rich in farmland, it's been poor in nutrition for generations. 90% of Mississippi's food is imported. Everyone at all points of the food system has the right to good, healthy, fair, equitable food. Mississippi ranks 50th in the nation with more than 15% of its households unable to provide adequate food for family members. And according to a study by the CDC, The 18 counties of the Mississippi Delta are particularly vulnerable, high levels of poverty and high prevalence of chronic disease and mortality rates that significantly exceed the national average. Next slide, please. Even though Delta Fresh's vision is broad, we know change has to start small, so we're currently focusing most of our efforts in Bolivar County. Our work is called the Bolivar County Good Food Revolution, and the aim is to build a robust, sustainable, equitable, local food system. And we're building on the momentum of lessons that we've learned across the years, working with high tunnels, school and community gardens, doing community organizing, and consumer outreach and education. Not to mention our annual Harvest Festival, where foods from the Delta Fresh Garden served as farm-to-table meals for the community. Next slide, please. Now, Bolivar County itself is ranked among the least healthy counties in Mississippi. Bolivar County is ranked in the lower middle range of counties in Mississippi as it relates to improving the length and quality of life. Next slide. Just a little bit more about Bolivar County. The median income of individuals in Bolivar County is around $32,000 as compared to about $65,000 for the US. And 28.1% of the residents in Bolivar County are in poverty as compared to about 11.6% for the US. The child food insecurity rate is 23% for Mississippi, the second highest in the nation. And Mount Bayou, Mississippi, where we've done a lot of the Delta Fresh Foods work, is one of the many Mississippi Delta towns in Bolivar County that sits on rich soil worthy of farming. It was founded by former slaves, and agriculture was part of its history from the beginning. But by the mid-1960s, many African Americans in this part of the state were starving. It was so bad that then U.S. Senator Robert F. Kennedy traveled to Mississippi to investigate. Fast forward 60 years later, and food insecurity is still a problem. Next slide, please. So Delta Fresh is working to shift that paradigm in Mississippi Delta to one of access and preference for healthy foods, sustainable agricultural practices, and deep community engagement that can improve health and provide economic opportunities for the residents of the Delta region. Our theory of change is that communities can change their own reality by being involved in program planning, decisions, and implementation. I was born and reared in the Mississippi Delta, as I said earlier, and many times outsiders come to the Delta with the intent of fixing us. They want to fix us. We're broken. We don't need fixing. What we need are the resources and opportunities to change our realities to align with our vision of being healthy and wealthy. All too often, there is this continued exclusion of the voices of those most affected by the issues, and therefore those with the most at stake in the success of these projects go unheard. It's part of Delta Fresh's mission to address this. Next slide. We are addressing it through the Bolivar County Good Food Revolution Farm to Table project, which consists of a collaboration of partners working together to increase access and affordability to fresh fruits and veggies for families and children in Bolivar County to help improve health outcomes. Our project is being implemented on our newly purchased Delta Fresh Foods Farm, 13.1 acres in Cleveland. Next slide, please. So we're partnered up with 2 school districts, and we're focusing on children K through 8th grade. We will continue work with the North Bolivar County Consolidated School District, and that school district is a public school district located in Mount Bayou. It has 869 students in grades K through 12, and according to state test scores, 19% of students are at least proficient in math and 20% in reading. And 100% of the children are eligible for free lunch. Next slide, please. The other school district we're working with, Cleveland School District or Cleveland Central School District, has about 3,000 students. And this district's average testing ranking is in the bottom 50% of public schools in Mississippi. Students have an average math proficiency score of 29%, versus the Mississippi's public school average of 47%, and reading proficiency scores of 28% versus the 41% statewide average. Again, 100% of the children are eligible for free lunch. Next slide, please. So the Delta Fresh Foods Farm is the place for students to learn about food and nutrition. We have a new greenhouse and a mobile outdoor kitchen. The mobile kitchen will be used to offer demonstrations at schools and other facilities to students and their parents and other community members. And we're going to teach the students and parents how to prepare healthy foods that are good for them to eat. We plan to teach them to grow their own veggies and fruits and then prepare them, which will have that same like field to table concept. We also plan to host summer and fall camps and bring in groups of school children. So we have two goals, very simple: to increase access to fresh fruits and veggies for the students and their families that we will be working with, and to utilize the demonstration farm and the demonstration kitchen to teach healthy eating using culturally appropriate foods for students and their families. I have a short video, just a clip, courtesy of Save the Children, that I'll share with you, and just tells a little bit about the farm.
Good afternoon. I'm Chris Johnson, Delta Fresh Foods Farm Manager. Come along for the ride. All right, welcome to the Delta, where we have all the good soil, rich, fertile soil. This is our 14-acre farm we purchased through foundations. So we have some butter beans coming up. We have snap peas that's already up. We have sweet corn that's coming up. And the good thing about sustainable farming, this place has been in horses for about 20 years. So there's no chemical on this ground. This soil that's in the Mississippi Delta, you have that sandy silk soil, they say ice cream dirt, and people just love it, and it just grows just about anything, you know. This is a beautiful place in the Delta. As the sun set in the evening time, it's beautiful.
So you all can see just snippets of what the farm looks like. We've done a lot of work of infrastructure to get it to where it is now. If you go to the next slide, please.
Good afternoon. I'm Chris Johnson.
There you go. Okay. So another component of our work is our Youth Ambassador Corps, which consists of youth ages 16 to 24, and they are being trained in community organizing, food production, food distribution, marketing, and ongoing consumer education. This means members of our Youth Ambassador Corps, they're developing work and life skills that we hope sprout into numerous careers and entrepreneurial opportunities within the local food supply chain. Next slide, please. So this slide shows our recent ribbon cutting for the Delta Fresh Foods Farm that took place on September 23rd, and the unveiling of the demonstration kitchen named after our beloved first ED, Judy Blue, and was sponsored by Save the Children. I want to do one more video real quick, just to show you some of our voices of our youth.
I feel like it's a life or death situation. Like, you choose what you want to eat. You choose what you want to eat to save your life.
With Delta Fresh Food Initiative, we bring the change. We bring the idea of back to the table, simple meals that we can prepare and that they can taste.
We farm, we cook healthy foods. We have classes for the community to learn what you can eat, what's good for your body. We basically tell the stories behind the food.
Let's make it happen. Let's educate and empower. Make change. Real change. No more talking.
Okay, thank you. And our youth are making it happen.
I love that. No more.
It's a life or death situation.
So through generous support from funders such as Bolivar Medical Center, Math Foundation, Newman's Own Foundation, No Kid Hungry, Save the Children, My Hunger, and W.K. Kellogg Foundation, we've been able to support staff, purchase the farm, purchase major farm equipment, the mobile kitchen, build an outdoors pavilion, and complete some of the infrastructure work. So this work is very challenging and it's slow. However, it's very promising because of the rich natural and human resources and a growing desire to embrace change that can begin to bring health and wealth to small rural Delta communities. So I give it back to you, Nisha.
Thank you, Deborah. I love that. No more talking. And I know that those 13.1 anchors are going to be put to very good use. So
Yeah.
look forward to seeing all the work that you all will do. Next up, we have Gabrielle R. Sanchez, PhD, a professor of political science and the founding Robert Wood Johnson Foundation Endowed Chair in Health Policy at the University of New Mexico. Dr. Sanchez is a David N. Rubenstein Fellow in the Governance Studies at the Brookings Institution. He is also the director of the UNM Center for Social Policy. Also, the vice president of research at BSP Research, a leading survey firm focused on the Latino electorate. In his role at BSP Research, Dr. Sanchez has led several projects in partnership with No Kid Hungry and Protecting Immigrant Families, focused on better understanding how to help immigrant families leverage safety net resources in light of changes to the public charge rule. Thank you, Dr. Sanchez, for being here with us today. And of course, the same question to you. What has led you to this moment today?
Thank you very much for having me on this Rockstar panel. I have the benefit of being last in the conversation, which has allowed me to learn a lot from my colleagues already. Great question. I think, as somebody, a self-described data nerd, I think my passion largely comes from recognizing that unfortunately, our communities aren't often represented in conversations about data. Everybody says we want data-driven policy, but at the end of the day, there's far too few of us that come from communities of color, immigrant backgrounds, other underrepresented communities that can actually crunch the numbers. And I really view my role as hopefully digging into the data to give our communities voice. And I think what gives me the most passion every day to get up in the morning and tackle my role in this overarching movement towards ensuring families have access to basic necessities like food is hearing from many of our partners on the ground that will tell us your data helped us make a case to our legislature or helped us make a case to our city council to improve policy outcomes and give their communities the resources that they need. So with that, I'll jump right into it, if you will. Next slide, please. I think the first part of my conversation with you today is going to focus on just providing some data points to mainly put emphasis that many families across the country still remain in need of resources. I know across the country, the economy is starting to show signs of improvement, and that leads a lot of people to think that maybe we're in a better place overall in terms of financial well-being. But unfortunately, I'll share some data that suggests that at least for the Latino population across the country, far too many families are still not feeling this improved economy and are still in need of valuable support and resources. Next slide, please. Our team at BSP Research, through survey data and qualitative data, has been essentially tracking the economic well-being of the Latino population, Native American communities, African American communities across the last several years, especially as COVID, we know, had a disproportionate and devastating impact on those communities. Our team has been trying to track this population over time to see how we're faring. Have things improved at all? Are there still families in need? Given my expertise is in the Latino population, that's what I'll showcase for the most part with you today. But in Q&A, if folks have questions about other communities, I'd be happy to speak to that. You see it in this overview of data, and this is coming from a recent national survey of this year, 2023, of the Latino population nationally. We see that unfortunately, when asked directly, do you find yourself in a situation where you can comfortably afford where you live today? or on the other extreme, you cannot afford where you live, period, you see that 1/3 of Latino families across the country right now can either barely afford where they live or straight up cannot afford where they live whatsoever, right? So a sizable segment of the Latino population is just barely getting by at best, right? Not where we'd like to see our population fare at this point in time. We've also asked over the course of several surveys this pretty straightforward question. All in all, over the past year, would you say that your own financial situation has gotten better, has gotten worse essentially, or stayed about the same? And unfortunately, again, 1/3 of Latino families across the country indicate that over the past year, their financial situation has gotten even more dire. And just context, right? It's not like last year's financial situation was great for Latinos and everybody else across the country. So the fact that 1/3 of families are saying it's even worse this year than it was last year, I think is pretty telling. One somewhat positive standpoint from this segment of data is that we do find that 1/3 of Latinos, for the first time as we've been tracking the same question over the last 5 years, has indicated that things have actually improved for themselves. So, not overly optimistic, but I think the fact that 1/3 of Latino families say things are finally starting to turn for positive, hopefully it is some semblance of good news, and unfortunately a lot of not so bright news I'll share with you in terms of data. Maybe the most alarming data point of any that I'll share with you today is that unfortunately 6 out of 10 Latinos across the country indicate to us that they have $1,000 or less in emergency savings to get by if they lost their job, had a family health emergency, right? So 60% of Latinos only have $1,000 or less in emergency savings. Roughly 30%, almost a third of Latino households only have $100 or less to get them through very difficult economic time period. Next slide, please. Given this economic backdrop, it's not surprising that a large segment of Latino households are finding themselves in very difficult financial shape. You see 1/4 of Latino respondents, so 25%, indicate that unfortunately they're having difficulty paying for basic necessities, including food, heat, or utility payments. And for these folks, right, at the end of the day, they're having to make difficult decisions. Do I pay for food for my family, or do I pay to keep the heat on, right? And the fact that 25% or 1/4 of Latino families across the country are in that very difficult situation, I think it speaks to the very difficult economic period many families still find themselves in. You see 18% have lost their job or had their hours at work reduced. 23% have used up all or most of their savings. Right. Another sizable segment, almost 20%, have had difficulty paying for their monthly rent or mortgage. So it unfortunately puts them in a very difficult housing crisis where, again, they have to decide, do I pay for my rent or do I pay for food this month to be able to maintain just keeping their family's head above water, so to speak. You see, finally, nearly 30% have had basically no money left at the end of the month to save or invest in the future. Right. So we know unrealistically for many families, there's this notion, save for the future, right? Put some money away for a nest egg, right? That's just unfortunately not a reality for far too many Latino and other racial and ethnic minorities as well that find themselves in a difficult economic period, driven mostly, right, by driving cost of living, their wages not being able to keep up with the growing expense of basic necessities like food, utilities, and being able to pay for gas if they have a vehicle to get to work and get their kids to school every day. Next slide, please. Just a few other economic data points to set the table for some challenges that unfortunately our community faces getting the help that they need. You see that almost 40% of a national Latino sample, again, conducted really recently this year in 2023, indicate that they are extremely concerned that they will not be able to provide a good future for their children. A very basic underlying value all of us that have kids hope for is the ability, right, to provide their children with a better future and outlook than what all of us as parents grew up with. You see the fact that almost 40% of Latinos across the country are extremely concerned that they will not be able to provide this basic value for their children, again, is a strong underlying message of just how dire economically many families' financial situation is, that they don't feel they can provide a good future for their children. Nearly 1/3 of Latino households across the country are extremely concerned that they will not have enough food to eat every day. You couple, right, the 36% of folks who are extremely concerned with the 23% who are moderately concerned, right? That's over half of Latino families across the country that are concerned at a high level that they will not be able to provide enough food to eat every day for their families. Again, a very sobering statistic, but hopefully screams loudly the economic reality for far too many of our households that are not quite feeling the improved economy and still remain in a very difficult situation. Next slide, please. So that economic, backdrop, if you will, that is not very promising, right? A lot of sobering data that speaks to the economic challenges a lot of folks are facing brings up the next segment of my conversation, which is what obstacles might be preventing, in this context, particularly immigrant families, from being able to get access to government resources to help get through this very difficult economic time period that we see the data is suggesting many families are facing. One of those realities is what we often refer to as the chilling effect of many families, particularly immigrants, that have access to government resources, but might be afraid to utilize them because of fear of immigration challenges or even the most extreme deportation. So the next phase of what I'll share with you is data that we've collected over time with Protecting Immigrant Families as our partner in this research that hopefully will help all of us overcome that chilling effect and help families get access to the resources that we know that they need. Next slide, please. As I pull up the methodology from the survey that we conducted, which is where most of the data that I'll share with you as I close out comes from, I'm putting in the chat a link to a report that has all these specifications of the methods and a lot of the findings that I'll share with you so that folks don't have to scribble this down. You can get access to all this from the link that I provided in the report. I don't want to spend a lot of time on the methodology other to emphasize that this is a very large sample. I believe the largest sample ever conducted specifically of immigrant households and mixed status families, specifically asking them about the resources that they might need and any knowledge that they have about the shift in the public charge rule, which essentially allows immigrant families to be able to utilize government resources without fear of complicating their immigration status. I'll be happy to answer any of their Q&A about the methods, but don't want to waste our valuable time with you today talking about methodology. Next slide, please. So big couple take-home messages. And I think you might have to tab that to get the figure to jump up. There you go. Couple more and it'll give you all the data points. Maybe 2 more clicks, 1 back. I'm sorry. There you go. Perfect. So when we asked immigrants and mixed status families directly, did you need help? And we specifically framed this, specifically getting access to food and other nutrition resources. You see that almost half of that 1,000-person Latino sample, or excuse me, immigrant sample that included Latinos, Asian American immigrants, and African immigrant families, roughly half, 47%, indicated, yes, they definitely needed help over this period to get access to those basic resources. Next slide. And this probably has that same setup. There you go. Beautiful. Unfortunately, among that segment of the overall national sample that indicated they needed help, unfortunately, only half of those folks, 54%, actually applied and got the help that they needed. The other 46% indicated to us that they know they needed help, but specifically due to immigration concerns and fear of deportation, didn't seek out the help that they needed. And I think that's the chilling effect, if you will, is recognizing that you need help, but not trying to access it specifically because you're concerned about immigration complications and potentially the fear of deportation. Next slide. A big part of this chilling effect is the unfortunate reality that even among immigrants, right, folks that might be actively seeking out information to learn about policy changes, whether or not they're eligible for public benefits, et cetera, we found, unfortunately, in our research that far too many immigrant families are not aware that there's been a pretty significant shift in policy. And folks might not remember this well. Very first day in office of the Biden administration, the president put this action in place to essentially reverse the public charge rule. And unfortunately, that really went on deaf ears for immigrant families, the way that we've seen it consistently in our research. Not just this survey, but a host of qualitative focus groups with immigrants have basically found the same reality. Our immigrant communities across the country are unfortunately not aware of this policy reversal. And when we look deeply at the data, unfortunately, the knowledge level among Asian American and Pacific Islander families in the survey is even higher than the overall average, if you will. Next slide, please. In addition to just asking folks directly, were they informed about this shift in policy? We asked a number of other knowledge questions. I share this one with you because not only does it indicate that a large segment of the population out there gets this wrong, right? That unfortunately the reality is you should be answering this, that it's incorrect, right? You don't have to worry about applying for assistance programs because they won't cause immigration problems. Not only does a large segment of immigrant and mixed status families get this wrong, but you see a very large segment, roughly a third, are not sure at the end of the day, right? If you do have complications arise due to your immigration stance, if you seek out federal assistance. And we find again that unfortunately Asian Americans are the most likely to be unsure about how the policy reality is situating they themselves or their families right now in the United States. Next slide, please. Because as a researcher, I never want to just leave you with some troubling data without any action-focused items you can take with you and hopefully do something to overcome these challenges. I want to focus our last bit of time together with some action-focused messages that we tested in our research that hopefully gives all of you on the ground that work with immigrants some powerful messaging that hopefully helps overcome this chilling effect, if you will, that we know is causing obstacles from our people being able to access the resources that they need. Next slide. I'll walk through a few of these most powerful messages that tested the best with you in a moment, but I want to leave this up with you for a couple of seconds so you can digest some of these messages. And the two that I'll talk a little bit about are the bottom two that I won't walk through in more detail with you before our time closes out, mainly because it showcases that really directly emphasizing, right, the political figures' names that are associated with this policy really does have traction with immigrant communities. So don't be afraid to reference specifically that the Trump policies have ended, right? And emphasizing that the Biden administration has actually taken steps to try to remove these obstacles. We found in the qualitative focus groups, for example, that noting the candidates' names, former President Trump and current President Biden, gives some time horizon to folks and makes them feel a little bit more comfortable with hearing all the information about policy reversals because they understand policy change usually comes with election outcomes. Next slide, please. I want to walk through with you a couple of the two strongest performing messages that we found had the best impact on individuals overall in our data across different national origin groups and different racial and ethnic communities. This, what we refer to as an obligation and program value frame, emphasizes at the beginning, right? Your family counts on you and you always do what it takes to help support your family. That action obligation oriented frame we found tested very well because it's somewhat empowering. It gives folks an overarching theme that they can do something about their own livelihood and those of their families. We also find that naming the programs that we're talking about, WIC and SNAP, for example, are powerful because it gives people concrete programs that they might have already applied to or are thinking about applying to. So instead of using very broad themes about giving folks access to programs for food, using specifically the government programs we're targeting in this context, WIC and SNAP, can have more direct benefit and gives people a clue into what programs that they might already be thinking about applying to. And so at the end, you see finding out how WIC and SNAP can help you get your family the food they need to thrive. Again, using that action-oriented thrive language, we found tested very well, specifically in focus groups when we put this in front of people. Next slide, please. I think you'll have to click through that little highlight of just emphasizing what we covered. Thank you. I think one more, perfect. This other message that tested among the most positive of the many that we put in front of respondents emphasizes, again, concrete program value, right? So here emphasizing that the government recently made some immigrant families with children eligible for the child tax credit, specifically saying child tax credit payments of up to $300 a month is very powerful, right? Not emphasizing how much actual financial value is associated with the child tax credit doesn't test as well because it seems ambiguous, right? And often we found that putting large million or multi-million dollar aggregate values seems overwhelming to many families. It doesn't seem like, wow, we're not going to get those multi-millions, but emphasizing up to $300 a month specifically in child tax credit gives families a sense of something tangible that they can gain access to if they, again, take sometimes a risky step of actually applying for these programs. So specifically naming the program as well as the financial amount can have positive impacts for trying to get this in the minds of immigrant families to help them overcome this fear of the public charge rule and this fear of the chilling effect. Next slide, please. And so somewhat in closing, a really positive finding from the survey was that when we gave people this basic information about this shift in policy environment and read them some of these messaging themes, emphasizing the type of programs that they might be eligible for, you see it has a very positive effect. Just putting basic information in front of immigrant families increased the probability that folks would actually actively pursue funding by applying for these government programs by 50%. Right. So 50% of these folks said they'd be more likely not only to apply for programs themselves, but communicate to other families in their network that they can apply without fear of deportation as well. So we know basic information has a positive effect. So hopefully giving you folks some of this information that you can saturate in your networks as well will hopefully help us all collectively overcome this chilling effect and the standpoint of the public charge rule being an obstacle in the way of families. Final slide, I believe, is just noting at the end of the day, we know it's not just messages that work, but utilizing the most trusted messengers in our networks to help overcome some of this fear that folks have. And I emphasize in yellow that although TV news has a strong impact, many of you that are participating on this webinar can have a direct effect by either utilizing social media that you see that comes up as very strong, trusted messengers for folks, getting op-eds into your local newspapers, or yourselves as trusted community organizations. If we all work together by getting these messages out, you all as trusted messengers in these immigrant communities can have a very, very high and powerful impact on improving some of these outcomes and helping more of our immigrant families get the resources that we know that they need to help their families make sure that they have access to basic necessities like food. So I think that takes me to the end of my presentation. Thank you very much for your time, allowing me to share some data with you to close out this panel.
Oh, thank you so much, Dr. Sanchez. It actually is a perfect segue into our final minutes. We don't have any questions in the Q&A, but everybody on today's webinar will have the ability to find these amazing experts. Their information and website links have been dropped in the chat. That segue is a great way to close out our last three questions and kind of push them all into one. And that question is, how do we continue to increase community buy-in? Like you mentioned, Dr. Sanchez, that trust is essential, but not only community buy-in, but our community engagement. How are we continuing to encourage people here on this webinar so as they go back into their communities that they are looking for opportunities for political advocacy and such? So I'll pass that to whoever wants to take a charge in these last couple minutes. Won't pick on anybody.
Well, I think Dr. Sanchez summed it up perfectly with that last slide in that, you know, we need to use our voice. We need to get involved, whether that's locally through our, you know, state or tribal legislators, you know, it's through our federal, you know, congressional representatives. They're supposed to work for the people. So, you know, we just need to use our voice. Your voice is important.
And I'll just add, and happy birthday, Shelley, but I'll just add to Shelley's point that unfortunately, right, whenever we start to get on the cusp of a presidential election, there's a lot of conversation about mobilizing people to vote and getting active. But the reality is, when it comes to access to food, a lot of those decisions are made at the much more local level of government. And far too few of our population actually participates in city council, school board elections, things that actually have a direct impact on decisions that puts more food available to our communities. So let's just not try to get our people involved in elections when it comes to the presidential cycle. It's probably more important when we see these local elections like city council, mayor's races, school boards, etc. And then the other thing I'll emphasize is, if you all are aware out there of programs that can provide resources like food access in your own direct communities, make sure you as a trusted messenger and your communities are getting that word out. We find far too many of our people are just uninformed about resources that are available to them, and we all can play a role in that because our communities trust us as local experts in our community. So as a trusted messenger, let's make sure we're all providing information whenever possible to our own communities.
And Deborah, I'll pass that question to you as we close out.
Yeah, just quickly, you've called the three of us experts throughout this session, and I do believe we are, but I think the real experts are the people in the communities. They know exactly what their issues are, and they have some of the solutions to the issues. So I think just make sure we're being inclusive of those who will be most affected by these issues.
And to sum it all up, I think I'm hearing voice. Your voice, their voice, the voice that you have when you vote. And so let's continue to use our voice. I hope you all were nourished by this particular session. Again, thank you all so much. And as we close out, please make sure to head into all of the other sessions between today and tomorrow as we continue this Rural Hunger Summit. And thank you all so much, so much, so much.